Chinese authorities are warning that the deadly coronavirus is becoming more infectious as countries around the world scramble to limit the outbreak. China's National Health Commission has revealed the virus can be transmitted during the incubation period before symptoms even appear. The death toll stands at 80 now, with close to 3,000 confirmed cases. In Wuhan, the centre of the outbreak, 2 new hospitals are being built to treat victims. 4 cases of coronavirus have been confirmed in Australia, and that number is expected to rise. Well, there remains 3 confirmed cases of the coronavirus in New South Wales, with health authorities investigating a 4th patient. The state's Chief Health Officer, Dr. Kerry Chant, says a range of measures are in place to promptly identify cases.
There are 4 confirmed cases in Australia. In New South Wales, we have 3 confirmed cases, 4 cases under investigation, with us having announced last night that one of those cases under investigation is a highly probable case, where we'll get confirmation later today. So as soon as the novel coronavirus infection is suspected, patients are isolated so that we can protect both healthcare workers and prevent any further ongoing transmission. The diagnosis is made as rapidly, and we have laboratory capacity at our Westmead laboratories to undertake this testing. And once the diagnosis is confirmed, or even before that, the cases are interviewed as to their movements, their flight details, family and close contacts are identified. And then once the diagnosis is confirmed, or in cases where we highly suspect the diagnosis, as in this for this case I announced last night, we undertake that contact tracing. So we identify those people that are at close contacts, and we give them precautionary advice about being vigilant for symptoms and what to do should they become unwell. These patients are all separate and isolated. The one thing in common is that they have either travelled from Wuhan within 14 days or have been a contact of a confirmed case of novel coronavirus infection in China. The fact that there are more cases emerging, and as I indicated, we have 4 cases under investigation, actually says that the system we've got in place is working well. We are urging people that have travelled from Wuhan, Hubei province in China, and who become unwell with fever and cough, sore throat, feeling generally fatigued, within 14 days of their last contact with Wuhan, that they come forward for testing. And so the fact that we're finding these cases, we have a number of cases under investigation, we're able to rapidly isolate those cases and diagnose them. This is the best strategy for protecting the community from border transmission. A couple of these patients have been seen by general practice. In some cases, the story that the patient provides changes. So in one of the cases, it wasn't evident initially that they had a contact with a confirmed case. That information came later. So our general practitioners have been informed. We continue to work with them to raise their awareness. We are recommending that patients phone ahead if they're thinking they could have the novel coronavirus, and actually prompting a conversation with the GP, because the GP may well refer them to our emergency department for testing for novel coronavirus, because that's going to be the most efficient way of getting that diagnosis confirmed in the shortest possible time. We are monitoring with the other states and territories and the Commonwealth the global situation as it unfolds, and as you can see, there's been a rising number of case reports. I think it's too early to tell, but obviously we are closely monitoring the situation. We are continuing to learn about this virus, and it's pleasing to see the information that's coming out of China and from around the world, and how we have the best scientists and experts trying to gather as much information on this virus, how it's spread, how easily it's spread, as rapidly as possible.